So this PowerPoint contains few common questions and answer that frequently asked in NCLEX board exam. It gives few ideas and tips on how to find out the correct answer that are likely to be asked in our NCLEX board. When we will practice question every day and using our easy step-by-step process and review program, we prepare ourselves for NCLEX board. The first question here, to assessment effectiveness of inceptive spirometry, a nurse can use a pulse oximeter to monitor a client. So pulse oximetry or oximeter, this is it, we use a device. By using pulse oximetry, a test for measurement of oxygen level in our blood, oxygen level. Number one, they said oxygen saturation. Number two, hemoglobin level, partial pressure of carbon dioxide, and number four, partial pressure of oxygen. So by the pulse oximetry, what we check? The correct answer is oxygen saturation. Can you see? This is the pulse oximetry device. A small, simple device. We do not need any preparation to check the saturation of oxygen or for this test. If your patient has a nail polish, if any, should be removed before going to this test, right? A normal oxygen saturation level is around 95%. By this, we can get the percentage of oxygen saturation. Imagine a patient has a hypoxemia, means oxygen level is low in blood. So hypoxemia is inferent with oxygen saturation level are less than 92% or below. So what are the rationale? A pulse oximetry is a non-invasive method for monitoring oxygen saturation. It does not measure hemoglobin, partial pressure of carbon dioxide, or partial pressure of oxygen. Hemoglobin, the main component of red blood cell that carry oxygen from lungs, and is measured by a simple laboratory test. A arterial blood gas analysis evaluate gas exchange in the lungs by measuring partial pressure of carbon dioxide and partial pressure of oxygen. So we answered this question, but we learned something more from the rationale. They said arterial blood gas analysis evaluate gas exchange in the lungs by measuring partial pressure of carbon dioxide and partial pressure of oxygen. NCLEX board frequently asking the question from arterial blood gas analysis. Next question, a complete blood count is commonly performed before a client goes into the surgery. What does this test look to identify? So examine asks this question about the complete blood count, right? So means check for increase or decrease the blood cell count. So number one, potential hepatic dysfunction indicated by decrease the blood urea nitrogen. So this question asks hepatic means liver. If liver dysfunction, we check liver function enzyme like AST, ALT, not BUN, blood urea nitrogen, impaired if my patient have a kidney problem. Creatinine level supposed to altered, impaired, increase if patient have a kidney defect like chronic kidney disease, glomerulonephritis, lupus nephritis. Number two, low level of urine constitute normally excreted in urine. Number B, abnormally low hematocrit and hemoglobin level. So complete blood count must check the total red blood cell, total white blood cell, total platelet, hemoglobin, hematocrit, right? And number four, electrolyte imbalance that could affect the blood ability and coagulation property. So it is not the rule out for complete blood count. Correct answer is, they said, complete blood count, check the abnormal low hematocrit or hemoglobin. So complete blood count does not require any preparation. It, right? Very simple technique. If the simply to being used for other tests, sometimes we need fasting may be required. Right? We have to follow the specific instruction provided. And complete blood count does not require, like here, we see the red blood cell passing through the arteries. So red blood cell contain hemoglobin. It is the globin chain embedded iron. Iron carry oxygen. So if the complete blood count is low, means a low red blood cell count, hemoglobin low or hematocrit low, it indicates patient has an anemia. So if a high red blood cell count may indicate underlying disease such as polycythemia vera or heart problem. If patient have a low white blood cell count, be caused by autoimmune disease, cancer, condition of the more bone marrow problem, or medication side effect. So if patient have an abnormal platelet count, it can be medication side effect from any underlying disease. Let me read the rationale. They said low preoperative hematocrit or hemoglobin level indicate the client may require blood transfusion before surgery. So it evaluates, it helps you to go next intervention and planning. Possible renal failure is indicated by elevated BUN, blood urea nitrogen, and creatinine. Urine constituents are not found in the blood and coagulation is determined by presence of appropriate clotting factors, not the electrolyte. Next question. A nurse should expected to find which findings characteristics in a client with a nursing diagnosis of ineffective tissue perfusion. Select all types. So, examiner asking nursing diagnosis of ineffective tissue perfusion. Keep it in mind, there are few factors that may be related to nursing diagnosis in effective tissue perfusion, right? So if any patient has an ineffective tissue perfusion, it does mean altered affinity of hemoglobin for oxygen or decrease the hemoglobin concentration in the blood. This is the factor. Or like hypovolemia, right? So they said if your patient has an ineffective tissue perfusion, so what are the findings? Like edema, a skin pink in color, strong bounding pulses, normal sensation, skin discoloration, and skin temperature change. The correct answer is edema, skin discoloration, and skin temperature change. Rational said lack of oxygen to nourishing tissues at the capillary level causes edema, causes discoloration, and changes in the skin temperature. Pulses will be weak or absent, and the client will experience altered sensation. Pink skin color, strong bounding pulse, and normal sensation are the sign of adequate perfusion. So perfusion is the volume of blood flowing through the certain tissue. Certain tissue per unit of time. Usually blood flow is usually given in a unit per ml. And tissue perfusion can be measured non-invasively with a portion, right? And next question, a client required long-term ventilation therapy. He has a tracheostomy in place and require frequent suctioning. Which technique should nurse use? So tracheostomy, it is the incision in the trachea made to relieve an obstruction or breathing. So which technique should the nurse use? Number one, intermittent suction with advanced catheter. Continuous suction with withdraw catheter. Number three, intermittent suction with withdraw the catheter. And number four, continuous suction with advanced catheter. So in this picture, we can see this is esophagus and this one is the trachea. And here, an incision in the trachea made to relieve any obstruction to breathing, right? So we call tracheostomy. right? This is the tracheostomy. You see, air is going in and air is going out. So tracheostomy basically is a hole that is the surgeon made through the front of the neck into the trachea. A tracheostomy tube is placed into the hole to keep it open for breathing, like this, right? So what are the answer? They said intermittent suction. Why? Withdraw the catheter. So this is the catheter, tracheostomy catheter. So rationale to prevent hypoxia, the nurse should use the intermittent, not continuous. If you use the continuous, your patient will, it lead to hypoxia, means less oxygen in blood, hypoxemia or tissue. So suction should not last more than 10 seconds at a time. Neither transmitted nor continuous suctioning should be applied while the catheter is being advanced. Next question. For a client with a tracheobronchitis, the nurse formulate a nursing diagnosis of ineffective airway cleaning or related to the thick secretion, and after implementation intervention, the nurse expected with the client outcome. So the keyword is here, ineffective airway clearance. So what does it mean? So airway clearance or ineffective, a nursing diagnosis always expected by some guidelines. So if any patient is inability by an individual to clear the secretion or any obstruction from the respiratory tract, we have to maintain a clear airway, right? So after implementation intervention, the nurse expect which outcome? I said our goal is, if inability by individual or by the patient to clear the secretion or obstruction from the respiratory tract, we have to maintain a clear airway. This is the goal, right? So this is number one, the child exhibit a respiratory rate of 44 beats per minute. The child exhibit arterial oxygen saturation 85. Number three, the child exhibit clear breathing sound, and the child exhibit increased anxiety. So what implementation intervention the nurse expected the client outcome, right? So answer is the child exhibit the clear breath sound. We have to implement the intervention. Why? What is the explanation? The nurse should expect a clear breath sound because this outcome indicates an improved respiratory status and airway clearance. So lung sound or breath sound should be clear. If any problem, I have to check it again. A respiratory rate is 44 beats per minute is high and indicate respiratory problem. So an arterial oxygen saturation 85 is abnormal. So my friend, 44 beat per minute is really abnormal, right? Tachypnea. I don't expect that I'm going to take care of my patient and still my patient has a tachypnea. So the nurse expect which client outcome. I do not outcome tachypnea or bradypnea. Number two, arterial oxygen saturation 85, so bad. Arterial saturation of oxygen must be 100% or more than 95%. So it is not my expected outcome. My goal is clean the secretion, remove the obstruction, right? And maintain a clear airway so that patient can maintain the breathing. Number three, the child exhibit clear breath sound, no added sound, no whispering, no wheezing, no stridor. Arterial gas saturation 85, abnormally low, decrease or increase anxiety should indicate effective airway clearance, right? So nobody want to increase the anxiety. If I have a disease, shortness of breath, I'm struggling for the air, anxiety will catch me up. Here showing few normal findings, normal blood gas analysis findings. Normal pH should be 7.35 to 7.45. If pH less than 7.35, it should be acidic. If pH more than 7.45, it should be alkaline. Both are bad. Partial pressure of oxygen supposed to 80 to 100 millimole per liter. Partial pressure of carbon dioxide supposed to be 35 to 45 millimole per liter, and bicarbonate concentration should be 22 to 26, and saturation of oxygen supposed to be more than 95%. Very important for board exam. Here showing some condition that affect the oxygen saturation. So if your patient have a bronchial asthma, saturation of oxygen should be less. If patient has a COPD, if patient have a heart disease or collapse of the lungs because of broken the ribs or any accident, if patient has anemia, they have a shortness of breath, and saturation of oxygen supposed to be less than 92%, of any kind of pulmonary embolism or congenital heart defect. Here showing a few pathology like abnormal sound like stridor, and stridor is more common if patient has an upper airway obstruction or any foreign body in the throat, the cause of stridor. Then wheezing. It is effective bronchi or constriction, air trying to pass through the bronchioles. Wheezing is more common in asthma and bronchitis. And rhonchi, another abnormal sound, more common in COPD and pneumonia. And rales, common in chronic heart failure and pneumonia too. Next question. When caring for a client with a nursing diagnosis, impaired swallowing related to the neuromuscular impairment, the nurse should do what? My friend, examiner asking diagnosis impaired swallowing related to neuromuscular impairment. Let me tell you something. Many people with neurological disease such as multiple sclerosis, Alzheimer, Parkinson, or stroke, they have a swallow difficulties because their brain have a hard time coordinating the breathing or eating and drinking. Right? So they said, if anything like this, the nurse should do what? Place the client in a supine. I have a difficulty of swallow. Is it good supine position? Definitely no. Number two, elevate the head of the bed 90 degrees during the meal. Oh, my friend, you are healthcare provider. You are the lifesaver after the God. Just little bit intervention, maximum output. You change my bed 90 degrees and prevent the aspiration and save the life. Number three, encouraging the client to remove the denture and encouraging the thin liquid for dietary intake. So number three is good choice, but what are the most priorities? This is the answer. So answer is elevated the head of the bed 90 degrees during the meal. So patient care is important. So when you change the patient care, elevated the head of the bed, you prevent aspiration and save the life. So here showing the angle of the bed, semi-polar and a high polar posture. So the rationale said the head of the bed must be elevated while the client is eating. The client should place in a recumbent position and not a supine position. When lying down to reduce the risk of aspiration, the nurse should encourage the client to wear a properly fitted denture to enhance his chewing abilities. Thick liquid, not thin. So give them thick liquid, decrease the risk of aspiration. So if patient has an impairment of swallowing, it is good to give them any degree more than 30 degrees, but 90 degrees is preferable, or it depends on patient condition. But elevated the head of the bed is the priorities and save the life. Next question. When providing discharge teaching for a client with a multiple sclerosis, the nurse should include which instruction, right? So multiple sclerosis is a neurological problem. So if your patient have this, what are the intervention with instruction? They said, avoid taking daytime snack. What's the problem? If you take little bit sleep, rest. Number two, avoid hot bath and shower, right? Good choice. Why not? Let me explain next page. Number two, limit your fruits and vegetable intake. Why you should limit? No need. Number four, restriction food intake. Why you need to restrict? You have no problem. of kidney problem that you have to restrict. So correct answer is avoid hot bath and shower. This we learn from here. If my patient has a multiple sclerosis, I do not allow them go for hot bath or shower. Why? Why I do not do this? Rational said the nurse should instruct the client with multiple sclerosis to avoid hot bath and shower because they may exacerbate the disease. The nurse should encouraging the time to sleep because fatigue is a common symptom of multiple sclerosis. A client with multiple sclerosis does not require food or blood, food and fluid restriction. What is multiple sclerosis? So you see, this is the healthy person nerves, right? This is the cell body, and this is we call nerve fiber. Every nerve fiber supposed to be covered with a myelin sheath, and this it is called node of Ranvier and Schwann cell. Unfortunately, the person who have multiple sclerosis, their nerve sheath not covered by myelin sheath, we call demyelinated exposure fiber. When exposure fiber like this, problems start. So multiple sclerosis is a disease that affect the central nervous system. The immune system attack with myelin that protect layer around the nerve fiber like this picture, right? And causes the inflammation and causes the lesion, right? So the second page here showing few important note what every student must know for NCLEX code. Multiple sclerosis, pathophysiology, demyelination of myelin. Like this is called demyelination, exposure. Who is affected most? Young adult, 20 to 40 years old. Women affected more than men. What are the symptoms? The symptoms include fatigue, depression, numbness, loss of balance, and double vision. We call diplopia. So visual change, double vision or loss of vision is important. Patient feel numbness or tingling sensation or weakness in the limb, weakness, or paresthesia, vertigo, right? Urinary incontinence even, right? And how we diagnose it? We diagnose by magnetic resonance imaging or MRI. So this condition can be diagnosed by clinical history and examined by an experienced neurologist. Multiple tests we need to confirm the diagnosis, right? And there are no known cause for multiple sclerosis. Treatment can substantially improve the symptom. So for NCLEX board, I could tell you it is important avoid the hot bath because patient is already fatigued. When patient go for the hot bath, their muscle will be more fatigued. Another disease is similar to multiple sclerosis. This is called myasthenia gravis. Myasthenia gravis, a neuromuscular disorder that leads to weakness of skeletal muscle. The pathophysiology of myasthenia gravis autoimmune affect the myoneural junction. Usually, like this is one neuron attached with other neuron. That area is affected, right? And also lack of acetylcholine. And acetylcholine is a neurotransmitter. Who is affected? Women, as like as multiple sclerosis. Women 20 to 40 years old more frequently than men. Usually men is 60 to 70 years old affected more. The common symptoms of myasthenia gravis: involuntary muscle weakness, involuntary, not voluntary. Voluntary muscle is like your hand, your legs, involuntary muscle, right? And involuntary muscle is like GIT. Increase with activities and avoid. It is good to tell them to avoid public area, and constipation is more common. Also, double vision like here, right? So the initial symptom is typically specific muscle weakness and fatigabilities rather than the generalized weakness. And weakness is worsened with exercise and as the day progresses. So tell your patient take adequate rest, right? And also sometimes patient present with the eye, you see, myasthenia gravis, this is the ptosis because of fatigue of the eye muscle. It is very small muscle in the eye. So eye problems such as dropping like this, you see, dropping the eyelid. So eye problems such as dropping and double vision is more common. Also problem with speaking, problem with swallowing, or problem with chewing, dropping the corner of the mouth, dropping the eyebrows. It is the symptom, common symptom of myasthenia gravis. So how we diagnose? Positive penicillin test, confirm the diagnosis. So diagnosis involves physical examination and test to check the neurological problems. What else? The treatment. And there is no cure for myasthenia gravis, and medication may help to reduce and manage the symptomatic treatment. We use anticholinergic agents, right?